help, I've got a pug that's really doesn't like having drops put in its eyes. So today I'm talking all about how to get drops into a painful eye. And then my final question today is from Catalina, who says, hi, I have a question. My friend is having a really hard time to apply eye drops to her pug. Can you kind of run through kind of how to do this so that the pug doesn't get too stressed, because she's already running away and hiding every time as soon as she sees the drops and won't even accept treats. She has to take them every day for the rest of her life. So can you help? Okay, so to start with, I'm going to suggest to ask the vet or ask the nursing team to demonstrate how they are actually applying the drops, because it may be that they've got some specific tricks that they know that this dog is going to kind of get on well with, or just show you kind of how to handle the medication and how to hold the eye open and hold a dog's head, because it is tricky and it does take a little bit of practice. It's definitely a situation where of having a few more hands to help is beneficial, because one person can help hold the head still and open the eye, and the other person can administer the ointment. It's something that you can do by yourself, but like I say, it does take a little bit of practice. So ask your vet or nursing team for a demonstration. The next thing to suggest is to see if there are any alternative topical medication options that are either a kind of a different drug, a different kind of type of drug, or that are a different consistency, because you might find that actually having a liquid drop is easier than applying a gel, or vice versa. Some people prefer gels to liquid drops. Your dog might also prefer a change in the product. So the next thing to think about would be to actually warm the drops in your pocket before applying them. So if you're, very often, certainly with long-term medications, they might need to be kept in the fridge, and applying cold drops to the eye can be quite uncomfortable or quite a strange sensation. So warming them in your pocket before actually applying them might help make them a little bit more comfortable for your dog's eye. And then the next thing, this already mentioned that, she won't even accept treats, but we really need to try and get an association between having treats and having a good experience with having the eye treatment administered and having the eye drops administered. So start by giving tiny treats that your dog will like, then move on to giving treats while touching your dog's cheek or their chin. So not handling their eyes, not trying to administer any medication, but just having used to treats while they're kind of being handled, and then slowly work your way closer to the eye. Then start supporting the head a little bit more firmly. Start holding the head while you're giving treats again, maybe not handling the eye specifically. Then giving treats, holding the head and opening the eye, again not administering medication. And then finally, hopefully this won't take too long, but it might take a couple of weeks, going through the same process and then applying drops, all the while trying to distract with treats. You can even do one eye at a time. So do one eye, we're not having any stress, fantastic, let's leave it, have a half-hour break, and then administer drops in the other eye. And hopefully if we take this stepwise approach, the dog will get used to having the eye medication, will actually learn to associate it with having treats, or will certainly know that when it's getting treats, it's getting a reward for staying still and having the eye medication applied. If really we've done all those things, so we've tried different consistency medication, we're warming it up, we're trying to give treats, and we're not getting anywhere, or you're still really struggling, especially as this is something that's going to have to go on for the life of the pet, then you really need to have an honest chat with your vet. You really need to let them know, and then you need to talk about are there any other alternatives? So I don't know why this eye needs constant medication and lifelong medication, but you need to ask, are there any alternative treatments that might work? Are there any surgeries even that might be beneficial? We shouldn't be ashamed of saying, no, I'm really struggling, because our pets, be they dog, be they cat, they don't often let us do everything that we would like them to let us do, or everything that we really ideally would need to do. But there are often other ways, there are often other things that we can do to try and treat the same condition. So be open with your vet, don't be ashamed, or don't be think that they'll kind of think less of you as being a bad owner or anything like that. I can only help my patients and help my clients if I know that they're struggling. So be open with your vet and have a chat with them. So that's a few things to think about, and I hope that they help you get this wee pug to have the medication it needs in its eye.
You've been watching the Dr. Alex Answers video podcast. Remember to subscribe and head over to dralexanswers.com for any links, downloads, and get your question answered.